aging is this terrible thing that we've known about since the dawn of civilization, and that we've known it's terrible, and that we don't know how to do anything about it.
Would you say people who are alive today will live forever?
The answer is, well, much higher than 50%.
What is your particular longevity regimen?
If you count measurement as part of the regime, then I definitely do that, and I very much recommend that.
Plasma exchange or getting a blood boy?
The evidence is pretty damn good.
Do you feel that the longevity movement will become perhaps the biggest cultural shift since the internet?
It will completely eclipse the internet.
Welcome to the Becoming Superhuman podcast, where we interview pioneers of human potential on becoming superhuman and how to build an epic future for humanity. Today's guest is Dr. Aubrey de Grey, who many call the first longevity influencer. You may have heard him on major shows like the Joe Rogan Experience and at the Global Longevity Summits this year. He's president and chief science officer of the LEV Foundation. He co-devised Sense, which helped launch Methuselah Foundation and the Sense Research Foundation. He also authored the bestseller, Ending Aging. Hello and welcome. One of the questions that we're curious about is, for you in childhood, what experiences sort of pointed you in this direction of aging and mortality? Was there a significant or poignant moment that pointed you in this direction?
Yeah, so there were two. One of them was when I was a young kid, and the other one was when I was 30, or nearly 30.
Yeah.
So the one when I was a young kid was, I think I was about 8 or 9, and my mother was trying hard to get me to practice the piano, and I was resisting this. And the thing is that my mother brought me up on her own, and she really did an amazing job of it. So by the time I was even at this tender age, I already had a very strong sense of introspection. I really, wanted to understand why I thought what I thought. And
this was a question you were asking at 8 or 9. Why am I thinking what I'm thinking?
That's right.
And you and Dylan would have gotten along at that age.
So the thing I wanted to understand was, why do I not want to play the piano? And the answer was pretty obvious to me pretty quickly, which is that the best case scenario of what could happen if I spent all this time tapping away at this damn thing would be that I would become a good pianist. And I immediately realized that this was inadequate, that wasn't worth the effort, because there were already plenty of good pianists. And so, I would not be changing the world significantly by becoming another one. And so that crystallized pretty quickly, I'm going to say, into the understanding that that's what I wanted to do. I wanted to make a difference to the world. And I don't think I really considered the question, why do I want to make a difference to the world, which is, of course, the natural next question.
Yes.
I considered it later, but only briefly, because later on, I had get an understanding of what an axiom is, and I was basically fine with saying, I don't know why I want to change the world, and I don't care that I don't know. I just accept it as part of me, right? Anyway, though, I want to change the world, and so fairly quickly after that, I came to the conclusion that I wanted to be a scientist, because scientists are the people who change the world the most in the long run. And so
now why scientist over entrepreneur?
Entrepreneurs don't change the world. They're not much anyway. They, they sometimes develop new technologies, but that's the scientific part, or at least the technologist part, as opposed to the making money part. Making money is a means to an end. You can spend it on changing the world. But anyway, the next thing I had to figure out was, what am I best placed to change the world doing? And that was fairly easy for me as well. Because when I was 15, I started programming and found I was pretty good at it. So I thought, right, well, this is straightforward then. I will work on AI research, because one of the big problems in the world is the problem of work, the fact that people have to spend so much of their time doing stuff that they would not do unless they were being paid for it. And so I'll fix that by developing better automation. And so I pursued that path for about a decade. I went to, more than a decade, I guess. I went to Cambridge as an undergraduate doing computer science, and then after that I spent several years working in AI research, specifically software verification. So that was all very straightforward, and it went okay. I was doing this outside of academia, so none of what I did got published, but I basically rewrote the textbooks on software verification. But during that time, I met and married a biologist. I met her when I was, I guess, 26. We married when I was 28. She was a lot older than me. She died last year.
I'm sorry.
Was a full professor at UC San Diego. She was actually in the UK on sabbatical. And anyway, so she decided to stay and she quit her position. And but the thing is, over the next couple of years, I learned a lot of biology by accident over the dinner table, just by, asking her what she did today. And she, having been a professor for so long, she had a very natural way of giving leading answers to questions, so that the conversations would always be extended. Anyway, but after a couple of years, I began to realize that we were never talking about aging, and this is the second of the two incidents, right?
Yeah.
So I began to ask questions. I said, "Listen, you don't seem to be interested in aging," and she would say, "Well, no." And I would say, "Well, why not?" And she would say, "Well, because it's just decay, isn't it? What fundamental truths about the universe are you going to discover by studying decay?" And I would say, "Well, I know, but it's bad for you." And she would say, she would literally say, "That's not my problem." And I would say, "Well, it kind of is." And that would be as far as we would get.
I mean, it is detrimental to your health, after all.
It's detrimental to a lot of things. That was as far as I could get. So, and I rapidly determined that it wasn't just my wife, that biologists in general were spectacularly uninterested in aging. In fact, people in general, were making excuses for aging and so on. And I thought, what the fuck? What is wrong with everybody? But it took me a couple more years, but eventually I came to terms with this to the extent of, understanding that I had to switch fields, because even though I was working quite successfully on one aspect of aging, one hard problem, I'm sorry, nevertheless, the problem of aging was very clearly a much bigger problem than the problem of work, and therefore I really had to get stuck in and switch fields. And by that time, I was in a rather fortunate position. I had a job at the University of Cambridge in bioinformatics, which was very undemanding, very boring, but very undemanding. Gave me a lot of spare time and access to all the university facilities and all that. So I I was able to switch fields just by repurposing my spare time. I had taken this job in order to perpetuate my AI research, because I'd run out of other sources of funding. So that's how it worked. And I must say, I was quite pleased with how it went. But those are the two formative moments: the one with the piano and the one with my wife, my first wife.
Aubrey, that's such a great story. Why do you think society was so scared of talking about aging? Because people have approached other hard problems, but aging was like the scare. No one wanted to talk about it until you and some others did. So why was that?
Well, right. Of course, society really is still petrified of talking rationally about aging. I think it's pretty straightforward, actually. I don't think it's particularly surprising. Because essentially, aging is this terrible thing that we've known about since the dawn of civilization, and that we've known it's terrible, and that we don't know how to do anything about it. And people have been coming along saying they do know how to do something about it, ever since the beginning of civilization, and they've always been wrong. So what do? Either you spend your life being preoccupied by this terrible thing that's going to happen to you in, for most of us, the rather distant future, or you find some way to put it out of your mind and get on with your miserably short life and make the best of it, right? And the thing is, if you've decided that that's what you're going to do,
so it's so bad you'd rather ignore it.
That's right.
Yeah.
Then you've got to just figure out how to ignore it, right? And so you've got to rationalize it away. And it doesn't matter how irrational your rationalization is, just as long as it works. So people will make up the most infantile fairy stories about aging being some kind of blessing in disguise, like doesn't death give meaning to life, or, where we put all the people, things like that. And then they will immediately switch off their brains before noticing that they've just spoken complete bollocks. It's like, that's what I've been cooking with all this time. I came up with the phrase the pro-aging trance to discuss to denote this. And I did that because when I started coming across this, the only thing in my past that it reminded me of was a stage hypnotist show that I had gone to in my first year at Cambridge. Have you ever been to a stage hypnotist show?
Oh my God, yeah.
Yes? All right.
Yes.
Well,
I've seen them on TV, yeah.
All right. So there was a particular thing in the show that had stuck in my mind, which was the stage hypnotists, how it works. They they have a big audience. They have a system for getting some of those people into a light trance. They'll bring one or two people up on stage and get them into a very deep trance, and then they'll continue. All right, so they did that. And there's this one guy, the hypnotist did a logic thing. He said, okay, first of all, he said, okay, this is actually your right elbow and this is your left elbow. He switched the guy's elbows in his mind, right? And he drilled that into the guy to enforce that this really was the way around it was. And then he said, all right, I would like you to touch your right elbow with your left forefinger, right? And of course, there's lots of, reeling and writhing. And so that's funny already, but it's not the coup de grace. It's not the main thing. So that happened. But then the hypnotist says, all right, you can stop now. And the guy stopped. And then the hypnotist says, you couldn't do it, could you? And the guy says, no. And then the hypnotist says, why not? And the most amazing thing is that the subject will then give a completely lucid, grammatically correct, unhesitating answer that will have a logical hole in it the size of, Canada. And he won't notice that this is the case. And this is Cambridge, right? This is a guy with a high IQ. He's got his friends in the audience also with a high IQ rolling in the aisles. He doesn't care, right? And so this really stuck in my mind. And very much was brought back to my mind when I started discovering the crazy irrationality that people have when they talk about aging, even people who are perfectly sensible about everything else.
That is so fascinating. Yeah. It's true. And one of the things that drives me crazy sometimes is that when people say, if there was a pill that would make me live forever, or if there was an option to live forever, I would not take it. I want to die at whatever. And but then like they forget to ask the kind of the recursive question, or like, is there any day where you choose to die, right? And that when you ask them that question, universally the answer is no.
I've tried the recursive or perhaps iterative approach to this before, and it never worked. So about 15 years ago, I came up with a more humorous answer that kind of cuts through the lack of mathematical sophistication. Yeah. Someone said to me on stage, they said, how long do you want to live? And I rolled my eyes because I heard the question 1,000 times before, of course. And I said, right, I've got a question for you. The question is, what time do you want to go to the toilet next Sunday? Right? And everyone in the audience is like confused and doesn't understand what the hell I'm talking about. And I said, look, that's a stupid question, right? You all know it's a stupid question. But the thing is, you also all know why it's a stupid question. Namely, you're going to have better information on the topic nearer the time. And you're going to be able to act on that better information. So I don't have the faintest idea whether I want to live to 100. But I do know that I want to be able to decide when I'm 99 rather than having the choice removed from me by my declining health. Yeah, so that has worked a little bit better than the iterative approach.
One follow-up here, because one of the things we like to do is speak with contrarian thinkers like yourself that are just, and often they're just principled rationalists. Why is this an important problem, right? Or in another way, you wanted to change the world. And so therefore aging is one of the, I would assume in your view, one of the best ways to do that. Why is that a good thing?
Right. Well, I mean, of course, perhaps a slightly more accurate thing than to change the world is to improve the world. So what does that mean? So as far as I'm concerned, I guess I'm fundamentally a utilitarian. So that basically means, reducing suffering, increasing happiness. And it's completely unarguable that aging causes far, far more suffering than anything else in the world today. So, QED.
All right. Great. We're there. Thank you for that clear explanation. So, one question we had is that you coined this term, longevity escape velocity, and maybe you can just explain that history and what it means. And by the way, I love that because I started a company called Velocity after that phrase, escape velocity. So I'm
All right.
love that phrase. So tell us about that.
So the concept arose, and I coined the term, and I'm going to say something like 2004. The concept arose as a result of the big eureka moment that I had in 2000 about how we should actually go about aging, fixing aging. Namely, that we should do it by preventative maintenance, aka damage repair, rather than by slowing down the rate at which damage is generated in the body. So everyone was comfortable, though they didn't really use this terminology, with the idea that aging is a process of the accumulation of self-inflicted damage that eventually exceeds what the body is set up to tolerate, and therefore you get sick and you die. Everyone kind of accepted that. But the assumption was that slowing aging down would be much easier than repairing aging. And I realized that just wasn't the case. A large part of why I realized it was that I had chosen my own path in terms of what areas of biology to explore in the literature. And I'd gone way beyond what nearly every person who called themselves a gerontologist actually knew about. So I was able to put a lot of bits together. Because, of course, damage repair is by definition almost a divide and conquer approach, a multi-pronged approach. All right, then. So then I realized that if you take someone who's already in middle age and you slow their aging down, you don't even benefit them very much because they've already got most of the damage that they need to get sick. So that's one advantage of being able to repair damage. But the other thing is that you buy time. If you take someone who's already 60 and you fix them up a bit with, let's say, an incomplete but somewhat comprehensive panel of repair interventions, then you will get them back to being biologically 40 in terms of the amount of damage that their body contains. And then, the body will accumulate damage. Of course, the damage that they get over the next 20 years will be enriched in the difficult damage that the repair panel doesn't work on, because you can use that repair panel as often as you like. So basically, you've only got the difficult damage. However, that means that if you carry on using the same interventions after someone gets back to being biologically 60, they won't work because it's the wrong kind of damage. But scientists like me will have had 20 years in which to improve the treatments so that they're more comprehensive and so that we can repair some of the difficult damage, shift it into the easy category, and you end up being able to rejuvenate the same people. And of course, the idea is that you carry on being able to do that. And so my definition of longevity escape velocity was simply, it's the minimum rate at which scientists need to improve the treatments in order to stay one step ahead of the problem. Now, it really only kicks in once you've got about 20 years of postponement of aging in the first place, because if you've only got, say, 2 years, then you won't be able to get enough improvements to get the next 2 years. And it's for that reason that I've always said that longevity escape velocity is actually never going to be achieved in mice, and it's touch and go whether we'll ever do it in cats or dogs, because you just don't have time, right? But humans, it's relatively easy. Someone else actually, so a few years later, coined the term the Methuselarity, which is the point at which we reach longevity escape velocity. And it makes sense to have such a term because once we get there, there is no way in hell that we'll ever fall back below longevity escape velocity.
Right.
If you think about it, longevity escape velocity actually slows down as time goes on because the remaining damage that you still can't fix, it takes longer to accumulate to a problematic level.
Aubrey, would you say that have we reached longevity escape velocity? Would you say people who are alive today will live forever?
So those are two very different questions. The first question,
that's true.
I do not think we have achieved longevity escape velocity. I think we have maybe a 50-50 chance of getting there in the next 12 to 15 years, so towards the end of the 2030s. Mm-hmm. Some people are all, like Ray Kurzweil, a little bit more optimistic than me, but we're in each other's ranges. Do I think people today will live forever? Well, first of all, that is one of the most dangerous things that I never let journalists do is to conflate aging and death. Because obviously there's one or two other things that we can die of. I mean, I'm very happy that other people are indeed working on, self-driving cars and asteroid detection and so on. But I don't work on those things. However, the point about can people alive today avoid aging forever? The answer is, well, much higher than 50%, because, of course, many people who are alive today will not be even 60 at the time in 12 to 15 years from now.
That's a very precise answer. Thank you for that. And how do you think the latest advancements in AI, large language models, computational biology has impacted the estimate of longevity escape velocity, in your opinion?
Well, my estimates have always done something that a lot of people's timeframe estimates for any technology do not do. Namely, I factor in the frequency of miracles. Most people will look at a problem and they'll say, well, okay, this is how difficult it is. This is how rapidly we are progressing, and they extrapolate from there. But they don't incorporate the possibility that some big, huge thing will happen. And I do. And the way I do it is basically by looking across all technologies and saying, how often do miracles occur? And then you could just say, look across medicine. So what counts as a miracle in the past, let's say, couple of decades? I would say that IPS, induced pluripotent stem cells, they count as one. CRISPR certainly counts. And I would definitely say that AlphaFold counts. AlphaFold, the program, you can give it an amino acid sequence and it tells you what shape the protein is going to be. So, of course, AlphaFold is very much a product of the AI revolution. And, these things happen. So, in that sense, I had already priced in the contribution of AI to progress. But that doesn't. But I'm still very happy that it's happened, because that's one fewer miracle that we need. And of course, there are plenty of other ways. The ways in which miracles tend to help are not necessarily restricted to aging. So none of the three I mentioned is restricted to aging. They all span all of medical research. Some things are more specific to aging. But one thing I often have to remind people, though, is that AI does not generate data out of thin air. It generates insights from data. And therefore, there is a whole bunch of wet lab work that still has to be done in order for AI to help us any more than it already is helping us. Right. And that's why in my foundation, I focus on mouse lifespan experiments.
One of the questions that I think many of our listeners would want to know is, what is your particular longevity regimen, or at least maybe three of the top things that you do so that they can be around when escape velocity arises?
Yeah, so I'm 62 and I'm doing very well for 62. I get tested a lot for very high-end tests of my biological age, defined in all manner of different ways, and I always come out at least a decade younger than I really am, which is nice. So that has a few consequences. The first one it has is, the sensible thing for me to do is to be more conservative than most people. If it ain't broke, don't fix it, basically. So I'm just one of those repulsively lucky guys. I eat and drink exactly what I like and nothing really happens, and I don't even need to do any exercise. It's crazy. But here I am. So that's me.
And how do you know that you're a lucky guy? Like, what are the markers that you look at?
Lots of markers. So, I always kind of thought I was, and then starting in, I think, 2002, people started to see that I was sufficiently prominent that they were willing to give me expensive tests for free. So I've had a lot of those. These days I do pay a bit to Human Longevity, which is a great company. And I get, very high-end things, whole body MRI, and they measure 100 things in your blood, and they do all sorts of physiological and cognitive tests. So yeah, I've got a pretty good idea that and this is one thing I will certainly say, that if you count measurement as part of the regime, then I definitely do that, and I very much recommend that. I think that, it is crazy not to know how well you're doing. Brian Johnson, a controversial figure right now, also makes a huge point of that. And I think, the big thing that makes Brian a net positive in this community is that he really hammers home the measurement thing.
I wanted to do something fun here, Aubrey. We wanted to do like a hot or not lightning round, where we wanted to present you with popular longevity treatments that have trended in social media recently, and get your quick take on whether it's hot or not, and like a very quick one-liner on why. So, do you wanna? Would you be up for that?
I suppose.
All right. Your enthusiasm is just gushing.
Let's see how this goes. All right. Rapamycin.
It's a theomimetic, which means that it's great if you're a mouse, and it's probably good for you if you get the dose right, and so on if you're a human, but it's only a little bit good for you because calorie restriction in general, and therefore all calorie restriction mimetics, are much less effective in long-lived species than they are in short-lived species. Plus, also, they're less effective if you start late in life than if you start early in life.
Beautiful. Makes sense. Metformin.
Metformin, same kind of deal. I think at this point, rapamycin has become the gold standard theomimetic just because of the magnitude of the result. Metformin is also a theomimetic, works in a different way, probably doesn't work quite so well, but does have benefits, certainly obviously against diabetes, and that seems to have benefits against things in general. So it's good, but not much good. Not the fountain of youth.
Is a slightly controversial one, injecting your penis with Botox like Brian Johnson has.
I wouldn't know.
Acarbose and other drugs that slow down carbohydrate digestion.
So acarbose is another theomimetic, again, works in a completely different way. And I think the fact that it's so different, especially very different from rapamycin, is consistent with the fact that when you have them both in mice, you do get an additive effect. This has been shown by a number of groups now. So yeah, I mean, same category.
Plasma exchange or getting a blood boy.
This comes into actual damage repair, of course, actually turning back the clock rather than just slowing it down, unlike all the other ones you just mentioned. And yeah, I mean, the evidence is pretty damn good that if you rejuvenate the blood, you will rejuvenate the body in many ways. The topic it has been really prominent in the research community for 20 years now, since the Conboys and Tom Randall's lab did the pioneering work in this. And honestly, everyone has been rather surprised at how difficult it has been to pin down what is the active ingredient. Whether even to pin down whether it's mostly the elimination of bad stuff that you have more of in later life versus the depletion of good stuff that you need in later life. Even that is still an open question. I think that the fact that plasma exchange is now being used in the clinic is extremely valuable, and that we will learn more over the next few years. But yes, I mean, certainly everything points to this being quite a useful thing to do.
That's great. Seemed like the hardest rating from Aubrey so far is a plasma exchange. All right. Various GLP-1s ranging from Ozempic to retatrutide and so on.
Yeah. So, I mean, I would not quite put the GLP-1 agonists under the category of theomimetics, but that may change. There's still work to be done, especially because there are, as you say, quite a few of them, to determine really what the mechanisms of action are outside of weight loss. But certainly weight loss per se is a very good thing, especially for people who are overweight. Whether it will have any effect on aging of people whose BMI is already in the low 20s is unclear. And so I think the jury is still somewhat out there.
There's got a lot of attention recently, measuring nighttime erections.
No idea.
Not hot. All right. Sauna.
Well, I have a sauna in my house. I don't use it very much, but that's because I also have a hot tub, which I prefer. Hard to say. I mean, hot tub doesn't really stress you out. It's not really got a hormetic effect the way a sauna would, or a cold plunge or anything like that. Hormesis is real. I mean, the way that a sauna works is basically by stressing the body. Well, this is the way most people think it works anyway, by stressing the body in a manner that turns on defenses against that stress, and those defenses stay on after the stress has gone away. That's what hormesis is. And so it kind of can be helpful, but the magnitude of the effect, probably pretty small.
Okay. And then cold plunge. What do you think about that?
Same, exactly the same, really.
Last couple, plant-based diet.
Yeah, diets are so hard. I mean, I'm not an expert on diets in the first place, and it's not what I do. So I'm really the wrong person to answer the question. But of course, most of the difficulty with any dietary regimen is to ensure that it isn't deficient in anything. There's nothing wrong with McDonald's in terms of what you're eating. Well, there's something wrong. You shouldn't do too much of it. But the point is, the main thing that's wrong is what fast food does not have in it. And if one cuts out an entire sector of potential dietary components, like meat, then one is potentially in danger of having micronutrients that are essential and that one is short of. So, it has to be, one has to move with care in such areas.
How about carnivore diet then? Just eating only meat.
Same deal.
Cool. Thank you. That was fun. Got through a lot of stuff there.
That was really, really good. One question I'm sort of curious about is your view on whole foods versus taking sort of packaged foods, right? Like people put it together and go, well, this is a complete meal in a shake versus trying to get everything from plants and whole animals and all that.
Yeah, so I don't have any particular insights, but the general thing is that we always have to take into account the things we don't know, the things we don't even know that we don't know. And in particular, for every, if you just look at the blood, if you look at the molecules in the blood, for every molecule whose function we know, or at least whose main function we think we know, there are plenty of molecules whose function we have no idea of. And it's the same deal with this. If you're putting things together based on what you think you need in food, then you will be missing things that we haven't even discovered yet, and that's probably going to be a net negative.
And do we have a sense of how many are unknown versus known? I mean, is it an order of magnitude? Is it less?
I would say really we have no idea. I mean, we can look at you can just look at a mass spec and look at all the molecules and ask that question statistically. But as I say, it's not just a matter of is there any function of such and such a molecule that we know about. It's also, for the ones that we do know a function, is it the main function or is it the only function? These are things that are hard to estimate.
Yeah, that makes sense. And do you feel that the recent breakthroughs in AI have changed or accelerated this trajectory in terms of understanding how the body actually works and and what the main functions of these molecules are?
I think that's another question where I would say the jury is a little still out. I would say that AI has the potential to do this because the data from which the AI will begin is the right kind of data. Mass spec surveys of what's in the blood or what's in a cell and so on. However, the difficulty is whether we actually have enough types of data. It may be, for example, that one needs data on at the level of concentrations of things, cell-specific concentrations, diurnal changes or other changes, the dynamics of how these things change, in order to figure out what's going on. And as I said earlier, if we don't have the data, then AI doesn't have a place to start.
Right. And to me, that seems like one of the main mediating factors is, with any system, the faster you go is really based on how quickly you can learn. So the more data that we can get into AI systems and the faster we can iterate, then the quicker this whole thing goes.
For sure, yeah.
Well, the generation of data also gets faster with things like AlphaFold because you can zero in on more accurate tests that you can perform, right? So the per I guess man hour of scientist time, we get a lot more data with AI.
Yeah. So the key thing is here that the initial data that you have to start from, like for example, all the crystallography data that AlphaFold started from.
Yes.
Those types of data, some types of data are inherently easier to accumulate and acquire than others. And so it's really not so much the magnitude of the data overall, it's the number of types of data that AI needs.
Right.
Maybe that some of the really difficult ones, like mouse lifespan data, which is what we do, LEV Foundation, are necessary, and they're hard to acquire quickly.
What are the out of the therapeutics that are being researched right now, what are the ones that you think, based on the latest information, are most promising? There's senescence to cellular reprogramming to plasma exchange, variety of number of things. Any that stand out to you? What are you most excited about?
So the good news is that no, nothing stands out. And the reason that's good news is because so many things would stand out if the other ones didn't also exist. Essentially, we've got a situation now in which, at least in mice, we're getting very substantial, at least significant increases in mouse lifespan with interventions that are initiated late in life, in middle age, and they're working in very different ways. So most of them looks like they are not CR mimetics. So this is the basis for, first of all, optimism, and second of all, for the experiments that we're doing. We are putting these things together and seeing whether they have additive effect. And we are seeing that they do. So we're hopeful that the more we can do of them, the greater the additive effect, and eventually we will be really able to, do earth-shaking amounts of life extension in mice, which will be enough to get the world to wake up and do something about human aging. And the thing is that the discovery of these various promising interventions has hugely accelerated. 3 years ago, when we started the first mouse combination study, we didn't really have much choice. There were only a few things out there that had shown promise. And during the 3 years that experiment took, it just cascaded. We're now going to do an experiment with twice as many interventions, with 8 interventions. And honestly, if I had the money, we'd be able to do 2 of them in parallel.
Yeah, that's really exciting. You just reminded me of there was a paper that was it in Nature a few weeks ago. A Chinese group of scientists injected modified stem cells to macaque monkeys, and they saw whole body rejuvenation, including improvements in cognitive function, which is one of the scariest things, right? Like, neurons don't easily regenerate. So if we can reverse aging at that level, that's extremely exciting.
Yeah, it was an exciting paper, that's for sure. There's a lot of interest in following up on that. The fact that it was in monkeys rather than mice is, of course, a big advantage. But the key thing was that it looks like it's a way to overcome a huge problem with stem cell therapies, which is that stem cells, however useful, however appropriate, however regenerative they are, when you put them into an old body, they get overwhelmed by the environment that they're in. So you have a kind of mass action issue. The more stem cells you put in, the better you can get, but there's a limit to how many you can put in. So what this group appears to have done is found a way to essentially make the use of the stem cells more resilient, if you like, the stemness of them. And they use mesenchymal stem cells for this, which are kind of the one of choice in terms of versatility. They affect, a lot of different, they repair a lot of different things when they go wrong. So that's good. Also, the way in which they work is very important. They, most people believe anyway that the main way in which MSCs are beneficial is because they secrete exosomes, these vesicles that then fuse with other cells and transfer goodies into the other cells. And a lot of people have become interested in the idea of not injecting stem cells themselves, but injecting exosomes instead directly. But of course, that would be expected to have a rather more short-term effect than if you're injecting cells that can survive. Then you've got the question of whether the MSCs really will survive, because, of course, if they're allogeneic, if they're taken from another person, then the immune system will go after them eventually. But again, this is something that can be addressed. So, it's very exciting area.
So before we move on to our next topic, one question we'd like to ask is, What's something that everyone or most people get wrong about aging today?
Well, I think it's pretty clear the number one thing they get wrong is that one way to put it out of their minds is not just pretending that it's a blessing in disguise, but pretending that it's somehow off limits to medicine, that it's somehow completely distinct from everything that we call a disease. And so when I give talks, especially to non-specialist audiences, I almost always begin by nailing that mistake. Once you have a good definition of aging that demystifies it, the accumulation of self-inflicted damage that eventually makes you sick, then it's easy to explain that the so-called diseases of aging, like Alzheimer's or almost all cancers or whatever, have no meaningful difference from the aspects of age-related decline that we don't call diseases, like frailty, whatever that is, that these are all just the only difference is semantic. That there are some aspects of aging that we've chosen to give disease-like names to, but calling them diseases is really a problem because it makes people think in terms of infections. It makes people think that we could actually cure Alzheimer's disease. Complete nonsense. There's no way we could cure Alzheimer's disease. It's a side effect of being alive, And so vast amounts of effort and money are thrown at completely quixotic approaches to these things. So that's what people get wrong.
Thank you. And on the topic of Alzheimer's, we had on the podcast last week, we had Trevor Miller, who founded Ambio, and they deliver ibogaine research, and they're seeing a lot of impact around neurodegenerative diseases like Parkinson's, and they've also seen some positive anecdotal effects around dementia and Alzheimer's. What are your thoughts on the use of ibogaine or other psychedelics as one of these avenues, at least around cognitive decline, if not other aspects?
Yeah, again, a very exciting area. It's definitely under-researched. More needs to be done, but it's getting a lot of attention these days. Not long ago, I'm going to say only a few months ago, there was a report in a good top journal of mouse life extension, again, my favorite measure of actual efficacy, from psilocybin, which, people have been interested in for a while, but no one had actually done a lifespan study, and they now have. And again, this was starting late in life. So, I think the evidence is piling up that we should be doing a lot more investigation of these things.
Aubrey, one thing I appreciate about you is that you're one of the very first people to really, go out of your way to raise awareness about aging and longevity. And when you started, it was really hard, I imagine, to raise capital at all for these things. And fast forward to today, there are billions, if not tens of billions, likely even more. I think the Arab Emiratis just dedicated like 100 billion or something to longevity and aging research. And so a ton of money is going into aging related problems, which obviously, likely you think is a good thing. But is there too much money going into certain areas and too little to other areas? What's your opinion on that?
For sure, that's the case. So you're quite right. When I started, it was just really an academic discipline. I was essentially, because I came up with the concept of longevity, escape velocity, and started, being public about what that meant in terms of likely longevity. That got the attention of the media. And so I started doing a bunch of media, and then not long after that, I was invited to speak at TED, and, things got pretty hot after that. So I've definitely, been pleasantly surprised, to be honest, at how effective I have been at community building, growing this community. I am just as proud of my successes there as I am of my successes on the science. And so I continue to do both of those things. But yeah, the world is completely different. I mean, 10 years ago even, there was just not an industry at all. There was almost no private sector in this world. And now there's hundreds and hundreds of startups, as you say, and some of them are very well funded. I mean, when I look at how long it took, I'm thinking, why on earth did it take so long? But the fact is, people had to change their mindset. Bezos is a great example. He's probably the single biggest investor in the space now, $3 billion in Altos. His journey began when he saw my TED Talk in 2006. And, so it took him 15 years to figure it out, right? And that's not because it took a long time to be interested. Every year at TED, he would come up to me and his own initiative and, ask me for updates and so on. But in terms of actually writing a check, these people have a big mental block. So yes, to answer your question about the unevenness with which things are funded, it's huge. There are some things, any divide and conquer approach to anything, it's going to have some components are easier to develop than others. Some components are more monetizable individually than others. And of course, those low-hanging fruit are the things that are getting most of the money now. So senescent cells, absolutely, partial reprogramming. It's fantastic that these things are being so well funded, but it's tragic that other things which are undoubtedly every bit as necessary, but are less far along in the path to fruition, are still struggling. And certainly the work that we do at LEV Foundation comes under that category because we're not even creating new intellectual property to speak of. We're taking things that other people have developed, or in some cases things that are just unpatentable in the first place, and we're combining them. So it's vital work. Someone's got to do it, but it can only be done in a non-profit capacity funded by philanthropy.
Do you think government should be playing a part in funding aging research? Because there's not even a category for aging, in their books. So what do you think about that?
So I think it's basically futile to consider what governments should do, because the fact is, we get the governments we vote for, right? And so, blaming the government, blaming the FDA for the slow approval of drugs is ridiculous. The FDA are just implementing the law. And blaming the legislators for it is also ridiculous because they have one goal in life, which is to get re-elected, and we elect them. It serves us right. So at the end of the day, of course, governments should be, but the only way they ever will is by changing public opinion.
I'm curious, for our listeners who have the means, what do you think would be a few of the most highly leveraged investments that could be made in this field, right? For our fellow contrarian thinkers that want impact.
Well, first of all, do you actually mean investments in the narrow sense of the term, or do you include donations?
Well, it could be a donation. I just mean allocating dollars towards something.
If we include donations, then absolutely, the work that we do at LEV Foundation is head and shoulders the most important, because it is not only a way to identify new things that work, it's a way to identify things that will get the public to break out of the pro-aging trance, and it'll kind of give the public permission to get their hopes up. And once that happens, we will have succeeded what I these days always say we need to do, which is to make aging the new COVID. We need to have an attitude to aging that we had 5 years ago, and we can see what the results would be. Because what happened with COVID was, vaccines were developed and globally distributed in less than a year, which is literally 10 times faster than it had ever happened before. Now, so that meant essentially governments doing what the public said, as I mentioned a moment ago, and essentially tearing up their own rulebook, the rulebook that they had written, right, in order to save as many lives as possible as soon as possible. And the point is, they did cut a lot of corners. And, I think we can say at this point with fair certainty that, some people suffered. But that's a good thing, because, the number of people who suffered is a teeny tiny proportion of the number of lives that were saved. And that's what we need to do with aging as well. So I believe that by dramatically changing lifespan of mice with late onset interventions, we can do that. The amount that we can currently extend a mouse lifespan, they normally live about 2.5 years. If you start when they're 1.5 years old, is 4 months. And 50 years ago, the best that we could do in that same context was 4 months. We have made zero progress in half a century, which means that, and also all the biologists of aging know this, right? Which means that if we were to get 12 months, then every subject matter expert would immediately know we were in a different world. And that would be enough for other experts to actually start, publicly stating, at least probabilistic, timeframes for how soon human aging can be brought under medical control as well. And once we've got that, once we've got a community of experts talking timeframes, that's what triggered the war on cancer 50 years ago, which was, of course, an insignificant thing compared to what I want for aging, but it was not at all insignificant for cancer research.
Absolutely, yeah. I truly hope that you get to continue to and double down on that work at LEV. I wanted to ask you, Aubrey, you started your career in AI and computer science, and you were interested in computational biology probably way before everyone else. And I thought of this because Jensen Huang was recently asked, if you're a new grad, what should you work on? What's the next big thing? And Jensen thought computational biology is about to explode because AI is getting faster and so on. What do you have any thoughts on the latest in computational biology and the most exciting areas there?
Sure. I mean, actually, the one thing you say in your question was not exactly correct. Back when I was working in bioinformatics, I didn't think that computational biology had much going for it. There were obviously certain things where computers were useful, but I didn't really see it going anywhere because, of course, AI research was spectacularly slow. This was a few decades before the Hinton Revolution, and so, but now, absolutely, I think I would certainly agree with Jason that, a huge amount of the action in biology is at the level of using LLMs and other AI tools, other machine learning tools to accelerate things, and conversely, that solving medicine is, the biggest application of AI.
So what's your advice to a new grad or a 25-year-old or someone who's starting their career? What should they work on if they're starting from like zero?
I mean, once you're 25, you may already have a PhD, so you're not really starting from zero. You've got certain areas of
Sure, fair enough.
Certain areas of expertise that, you are one of the most knowledgeable people in the world on. That's how you got a PhD. So I generally say, pursue the things that you're good at, but in particular, pursue the things that not many other people are good at. And so that kind of biases the question very much, and I would not want to generalize. What I would say is that one has to make the choice whether to stay in academia, whether to go into the private sector, or work in a non-profit capacity of one sort or another. And that, again, is, application specific. But, there are definite pros and cons, especially in the funding environment in academia these days.
Speaking of like kind of out there ideas, what do you think? Is there any almost sci-fi like treatments or protocols that could be unlocked by AI that you could imagine?
Well, I mean, one thing that's very important in this whole world is brain-computer interfaces, which are improving all the time at the level of the hardware. I would even hesitate to say which approach to BCI is likely to be the most effective. But one thing that I'm following very closely is the work of a company called, I think it's pronounced Icate, ICATE. It's a startup out of Caltech that is looking at spinal cord injury specifically. But rather than trying to fuse the two sides of the cord together, one puts in a non-biological interface, a piece of hardware that has, the two sides look at either side of this interface. And the reason that that's so exciting to me is that it doesn't just have to be a pipe, it can be a T-junction, which means that one can get information in and out. And the thing is that both sensory and motor information can be got in and out, and that's pretty heavy. You can learn a lot about what's in the brain from that kind of information. So anyway, there are various ways to do BCI. And of course, the reason BCI is so interesting, well, one of the many reasons, is that it's a method of enhancement, of getting people to be able to do more. And of course, people who are going downhill before we get to solve neurodegeneration, this applies particularly. So yeah, I'm very excited about that. And for sure, the information that comes out of BCI needs a whole lot of pattern matching and pattern detection, in other words, AI, to understand.
On that note, Aubrey, Ray Kurzweil thinks, because the evolution of the neocortex led to kind of the current human intelligence largely, if you can augment the neocortex with BCI and essentially migrate out of the biological substrate into a non-biological substrate, consciousness can essentially be on hardware or computational hardware, something like that. Do you think that's likely?
Yeah, well, actually, that's not quite what Ray says. The original idea of uploading, which is basically what you described, was very much like that. But
Yes, yeah.
Ray actually talked more about the merging of man and machine. So, in other words, where the biological substrate does still play a role. And that's really what I was talking about. I think that, we do have these questions about, continuity of identity and so on that come up when you have, straight up transfer of the information into a completely different substrate. The fact that you can do it more than once, things like that. But if it's an augmentation of the biological substrate, then one doesn't get any of those problems. One's basically got, a better iPhone, more or less, a better connection to the to better hardware.
Well, Dylan, really, you would like to be uploaded one day, or at least have some AI kids, so you don't have to worry about losing them. I mean, does that seem like a solution? If we're all going to live to 1,000 at some point, we just cut the biology out of the equation?
Well, the question is whether we would want to. Right. I mean, if we get really good at, keeping this wet stuff going, then, what's the motivation for doing anything else? Some people might have motivations that would at least lean towards doing that. Like, for example, if you want to, go to space. Space is a dangerous place to be if you're made of meat. And, but again, we just don't know how good we're going to get at making it a less dangerous place for, things for organisms that are made out of meat. So, it remains to be seen. But I think, a lot of people are just going to look at the motivation, and they're going to look at the parallel progress being made in these various different technologies. And if the progress in keeping the meat going is good enough, they're going to stick with the meat.
Well, you made a distinction earlier that I thought was important, which is between aging and death. And to me, if we cured aging, it seems that death would feel even more tragic at that point.
Right. So when I was I wrote a general audience book in 2007, and Stephen Colbert had me on his show, and he said this. He said, if we're all going to live to 1,000, then won't that kill any ability to take risk? I mean, you're not going to want to cross the street because you can't cure being hit by a bus. And I said, that's okay. Your grandmother can help you across the street because your grandmother is still going to be useful. And that actually made him laugh. I think I'm still the only scientist who got Stephen Colbert to get out of character on live TV. Anyway, so point is here, we're gonna, as I say, other people are working on other reasons to other causes of death, and if you make something that's currently risky less risky, then you're taking less risk by doing it. So if we chances are that progress in all of those areas is going to get even better than it's going to go even faster than progress against aging. So I really don't think this problem's going to come up.
So bringing it back to the present a little bit, one of the things that is really a big trend right now is biohacking, right? And there's influencers like Brian Johnson, and I'm curious your thoughts on that trend in general. We have friends that are injecting all kinds of peptides and things like this. Is this helping or distracting from the deep longevity science?
I think on balance, it's definitely helping. Basically, there's always been early adopters who've tried things that, were not approved or were not well tested because they thought it was working for them or that worked for their grandmother and therefore they'll try it. And what's happening now as time goes on is that those people are, less stigmatized, if you like. They're coming out of the closet and talking to each other and talking to the world. And in particular, that means that the quality of the contribution that such things are making is higher. We end up with people, first of all, being better informed about how to do this in a safe manner and in an informative manner, getting good baseline data before they start, for example. And secondly, how to exchange and report this data so that these individual N of 1 experiments can then be fed into, well, typically a machine learning system. And, patterns can be found even though this was not a randomized controlled clinical trial. We're still we're taking the baby steps in that direction, but it's definitely accelerating. And so, yes, I think it's definitely a good thing. And we're seeing, more and more of acceptance of this. In the US, there's quite a movement at the moment to expand the concept of right to try, which has historically only been available for people who have already exhausted all approved options for whatever condition they have. In Montana, in particular, it's now been approved, however healthy you are, just so long as the treatment in question has gone through phase 1, which means that now, for the first time, it's extended to preventative medicine, which is huge.
And for our listeners that haven't heard that phrase before, the right to try, would you just briefly share what that means? And
basically, all it says is that for as I say, for given stipulations. So in Montana, you've got the thing's got to go through phase 1. In New Hampshire, you still have to be terminal, but it's been broadened. In Florida, if I'm not mistaken, it only applies to stem cells and exosomes and not to anything else. But anyway, the point is that a treatment that comes under whatever jurisdiction, you can access it even if it has not been approved by the FDA. Now, accessing means you have to pay for it. It's not covered by insurance. It also means you do have to have it prescribed by a physician, but that's all. It doesn't have to be approved.
Aubrey, in a kind of somewhat related note, I was curious, the declining population growth in the West has been a kind of a big topic lately, right? And again, also in China, it's a problem. Do you think anti-aging could be a solution to that, or do you think it's more of like contribute to the problem? How do you see that?
Well, of course it's a solution. I mean, fewer people die, therefore population doesn't decline. Duh, really.
Do the math, Dylan.
Well. So the other take there is that because people would hold on to their wealth and positions and stuff like that, social mobility declines, and it reduces opportunities for younger people to climb the social ladder, and therefore people stop having children.
That last part is very interesting. So the rate at which births will happen, the fertility rate, is going to be impacted a great deal. In a variety of ways. One thing we've seen is that whenever any society goes through this demographic transition of a sufficient, female emancipation and education and so on, so there's a massive decline in how many kids the average woman has, there's also a small increase in the average age at which they have those kids. And of course, this is easy to understand, that, having kids is very time consuming. That's why I've never done it. You want to do it, only when you've done other stuff that you wanted to do with your life. So then if we don't have menopause anymore, which is certainly going to be one of the consequences, so for anyone in the audience who is thinking that they're rather looking forward to menopause, I want to point out that the idea is we'll be able to turn it on and off. The point is, if you can have kids safely at any age without any risk of Down syndrome or anything like that, then you may continue to put off having kids for the same kinds of reasons that people are currently putting them off by a few years. You can put them off by a few decades and then another few. So there may indeed be a decline in birth rate. However, the decline in death rate is going to be very much more precipitate than any decline in birth rate possibly could be. So it's a perfectly reasonable thing to say that, duh, as I said earlier, right? And actually, I will have a prod at Elon Musk here while I get a chance, because Musk is, I have a huge admiration for him. He's done the most amazing things with Tesla and SpaceX. But I mean, he's just completely, in the pro-aging trance. He'll say the most crazy, fucked up things. And
yes,
his main argument, he says he's really worried about depopulation, right? About the population decline.
Yeah.
but he just refuses to consider that eliminating aging would be the right way to solve it. He says, "Oh no, we've got to have turnover of people. The old people are going to, suppress creativity of the young." So my answer is simply, well, that's fine. We can just ship the old people somewhere else, like for example Mars, and then the young people will be fine. There's a there's a theme in the
Well, doesn't that, Aubrey? Doesn't that then get back to your question of like, what time do you want to go to the bathroom on Sunday? Like, what year do you want to be shipped to Mars?
Well, absolutely. I mean, of course, I'm only being slightly rhetorical because Elon is quite keen on dying on Mars, as he says, though not on impact. But yeah, of course, that's completely right. It's complete nonsense. People. The point about creativity is that it declines because of, number one, actual physical neurological decline, which we're going to fix, right? And number two, because of societal constraints, because society stratifies people by their chronological age, which is no longer going to be necessary when you can keep up with your granddaughter on the dance floor.
Actually, maybe it's important to clarify, like when people imagine a society where aging is solved, perhaps they're imagining a society where a whole bunch of really old people are hanging out without, unable to like do anything productive. But like the what we're really envisioning is a society where kind of everyone's kind of 25, right? Forever. Yeah. Ideally, in a perfect world.
I mean, the craziest thing is everyone knows this. Everyone knows that a lifespan is a side effect of health span. And yet, this is probably the most extreme example of the pro-aging trance. It doesn't matter how often you remind people that we're talking about a world in which everyone is chronologically old, or most people are, but nobody is biologically old. It doesn't matter how often you say it. They'll still come back and pretend that it went in one ear and out the other. It's absolutely nauseating.
Yeah. Well, I really like you using the analogy around the trance. Right? Because these things are hiding in plain sight, even for really principled thinkers, right? So Elon has an embedded idea that creativity will decline with age, as if we can solve all these other problems, but not creativity. And so that to me, I think is really interesting. Like, as we solve all these issues, could we even increase creative output per human, right? I mean, the research that Jonathan Schooler is doing at UC Santa Barbara is on actually cultivating curiosity, and they're actually seeing measurable shifts in creative output from people. So these things, it seems we could work on.
Of course, one of the other topics we already touched on, brain-computer interfaces, it has a potential to play a huge part in that. And what do you know? One of the leaders in BCI development is Elon Musk. I mean,
of course,
Elon's everywhere. He's everywhere except longevity, Aubrey. So maybe that's the next thing for him.
But as I say, it took Bezos 15 years. So, I mean, I didn't meet Elon nearly 15 years ago. So he's running out of time.
So one question that I found myself curious about, and wondering if you've spent time on this, is you're largely focused on how to prepare the body to live for 1,000 years. How do you think about preparing your mind?
I don't think about that. And the reason I don't think about it is something that, it comes a bit back to the toilet thing. Basically, but the question is, what is worth thinking about? A very strong rule of thumb that I've always had is that there is absolutely no point in thinking about any aspect of the long-term future. That basically there's just too many unknowns in between that will completely change.
That's fascinating.
Yeah. I mean, 50 years ago, we could not have conceived of a world with the internet. Just absolutely no way. So it's just a waste of effort to think about such things. There's almost nothing that I would say is an exception to that. The only thing that I would really go for is nobody is ever going to want to be sick, however long ago they were born. That's the only thing I will go for. And that's all you need, of course, to just define aging as the world's most important problem. But yeah, I mean, even like we were talking about population not long ago, kids may just go out of fashion. We just don't know.
Kids may go out of fashion. Well, Speaking of fashions, I mean, do you feel that the longevity movement will become perhaps the biggest cultural shift since the internet?
Oh, for sure. In fact, forget the since the internet thing. It will completely eclipse the internet.
Yeah.
And then kids may go out of fashion.
I mean, this is that's very profound, right? Like, 'cause in a society that kind of doesn't have to deal with death is a fundamentally different society, and we'll just have to rethink everything from ground up, like everything from like how politics works, how families are organized, right, and
You're right.
what the meaning of relationship is, and like literally fundamentally everything that we take for granted will have to be rethought.
And let me highlight that in another way that we haven't touched on yet, which is anticipation. So as I say, I think we've got a 50% chance of reaching longevity escape velocity by the end of the 2030s, right? Which is not long in the future, but it's long enough in the future that most people in the private sector, in whatever industry, feel they'll wait and see, right? But here's the thing. As I mentioned, my goal is to make aging the new COVID, and I think I've got a 50% chance of doing that within the next 3 or 4 years. Now, what does that mean? It means people are going to want governments to spend lots of money fixing aging the way they did with COVID, but it means something else. It means that people are going to be in a mindset of feeling that chances are that the war against aging will succeed in time for them. In other words, their expectation of how long they are going to live is going to change overnight. They're going to start where they are today, thinking they're going to live just a few years longer than their parents, and they're suddenly going to think they're going to live essentially indefinitely. Now, what does that mean for the global economy? The global economy is essentially built on, industries that revolve around how long people think they're going to live. It doesn't matter how long anyone has lived so far. Think about it. Health insurance, life insurance, inheritance arrangements, pension funds, pension plans. So when I give talks to companies in those spaces, which I'm fortunate to do ever so often, the talk I give is called Anticipate the Anticipation. In other words, that the anticipation is the change in expectation of how long we're going to live. Anticipating it means working in advance in the next couple of years on developing whole new product lines that you can roll out as soon as that almost instantaneous shift in public opinion actually happens. It will be almost instantaneous. You will not have time to do it, reactively. And, whenever I give talks like this, everyone's terribly courteous, but I have the, extreme foreboding that everyone just goes away and, sleeps on it and wake up the following day and it was all a bad dream and they get on with life the way as if I never existed. So, it's a little bit frustrating, but it's got to happen.
Yeah. So, well, and that's interesting because knowing that happens and people sort of don't actually react to it. I mean, why not change strategy? Is there some other approach that has been more effective?
I have definitely been on the lookout for other strategies forever. And certainly one thing that made me very happy starting maybe a decade ago was the emergence of one or two people who had the same kind of understanding of the thing and, understood well enough not to make fools of themselves scientifically and everything, but whose style of discourse and communication was different. So one person I always highlight in this regard is Liz Parrish, who got into the field when she came to one of my conferences in 2013. She's not a scientist, not a biologist, but she's smart enough that she was able to grasp enough that she doesn't make a fool of herself. And she is completely different from me in terms of how she says things. She is the ultimate heartstring puller. And, it made all the difference. I had been bemoaning for like a decade how appalling it was, because I think I'm pretty good at what I do, but I only do what I do. Right. And now you've got Brian Johnson, same, again, completely different way of doing things, but completely fearless. And, people have been brought into the field in large numbers because of Brian Johnson that I could never bring in, and nor could Liz. So, yeah, it's like kind of that's a change of strategy, but not really a change, kind of a diversification of strategy. But the main answer to your question actually is not that. The main answer is that this is not a case that fits into Einstein's thing about, madness. Insanity is doing the same thing over and over again, hoping for a different result. In this case, actually, there is logic in hoping for a different result because it's all about hearts and minds, and therefore there is this thing called repeat advertising.
Yeah. And that war is being won very rapidly right now, especially. It was not quite obvious for a long time, but it seemed like people are already starting to think about it.
It's better than it was. For me at the forefront of the field, there's always this very, very big double edge, where on the one hand, I'm very heartened and happy that things are going so much faster than they were. But on the other hand, I'm always so frustrated that they're not going even faster.
Yeah. I mean, I remember I was talking with Michael Murphy, the founder of Esalen, back when I was involved there, and we were having early conversations with Tristan Harris, who did that whole documentary around social media being addictive. And his guidance to Tristan was patience. These movements take time. He's like, it took us 50 years to get, mindfulness on the cover of Time magazine. And so you don't burn yourself out with the impatience. And I remember that just sticking with me, that the cultural movements take time, but they get there. A couple last questions here. One is, if you could give every listener a permission slip for either one thing to start doing or one thing to stop doing, what do you think that might be?
That's the kind of question that I don't like to answer, simply because the answer is so different for different people.
Indeed.
If you're wealthy, use your money to hasten the defeat of aging. If you're a journalist, interview me on a podcast. If you're a biologist, choose a field that's impactful, that can actually make a difference, rather than one that probably won't. Anyone can do advocacy in one way or another by just talking to their friends and colleagues and, family. Family is a hard one. I have definitely known a number of high net worth individuals over the years who have told me straight up that they would give me plenty of money, but their spouse won't let them. In fact, it may not be a coincidence that Bezos got divorced shortly before donating to Altos. I had no idea.
A question I have, Aubrey, is about spirituality and longevity. How should people think about living a long life, but then what they how to practice spirituality, or I don't know if you have any practices that are relevant.
So I don't. So I mean, part of your question relates to one of the more prominent and common aspects of the pro-aging trance, which is people say we shouldn't do this because it's playing God, right? Now, what the hell does that mean? First of all, last I checked, God was supposed to be omnipotent. He can perfectly well strike you down with a thunderbolt, however healthy you are. But second of all, suffering is supposed to, Holy Scripture of whatever kind you might look at, it's pretty unequivocal that one thing that we're supposed to do with our life is minimize other people's suffering, right? Failing to do that, let's take the parable of the Good Samaritan. It basically says that inaction is morally equivalent to action. So, causing suffering is bad, but failing to alleviate suffering is just as bad. So it's perfectly bleeding clear that God wants us. This is God's work. And also, it's natural. I mean, people say it's not natural to fix aging. Well, I mean, tuberculosis is natural, but I don't see anyone complaining about the fact that we fixed it. What's natural for us is to manipulate nature in our interests. To what's unnatural is to not do that and to say, this is natural, let's leave it how it is.
By the way, I also really appreciate a question I did want to ask you, Aubrey, is that how do you, you're so broad in areas of research that you've put yourself into, and you've made original contributions to mathematics while you're doing all this stuff in longevity. That's fascinating, amazing. Like, what's your process to learn new things and go deep on those things?
I would say it's simply that I started out as more of a mathematician than anything else.
Okay.
I think that's why I found a really good programmer when I was a kid.
Yeah.
If you're a good mathematician, then biology is just easy. I mean, I had the advantage
Yeah.
of being married to someone who was able to teach me a lot. But the fact is, mostly it's just, a lot of facts. If you've got a good memory, you're going to be able to do it. And and like my first wife was a geneticist. She didn't know fuck all biochemistry at all. So I had to teach myself biochemistry entirely from textbooks and research papers. But it's a really easy subject to learn. It's a very horizontal subject. It doesn't matter which order you learn things in. So it's just like that. That's a large part of why I think a number of people have followed my path and moved from computer science or math into biology. It's just not very hard.
Yeah, I love it. Not a lot of people have the courage to dive into these heavy academic disciplines and just go
and of course,
make a change.
One of the big things that incentivized me, that made me think I had a significant chance of making a difference, it wasn't just that I'd been doing quite well in my AI work, and therefore I felt I was good at working on really hard problems. It was also that there's this history of people switching fields and doing really cool stuff in their new field because they are unencumbered by the conventional wisdom. The most famous example being the whole of molecular biology, which was invented by a bunch of physicists back in the 1950s. It certainly helped me enormously at the beginning. The realization that everyone was missing this preventative maintenance approach. Other people in the field just could not have had that realization because their background was too academic, too biological, and not sufficiently like an engineer.
I think we covered a lot of ground. We can wrap this up. This is incredible. Aubrey, to talk to you. I've been a fan of you for a very long time, and it's really great to just have a conversation and get your opinions on a number of different things. Thank you so much for participating and joining us today. And to all of our listeners, I hope you enjoyed this. Give us feedback, give us a like on Facebook, and subscribe, and tell us how we can do better. And thank you again to Dr. Aubrey de Grey for all of this, a lifetime of work pushing this field forward so that we can all live longer lives, and suffering can be reduced universally to all humans. So thank you so much.
Well, thank you. Thanks for having me.